We have the State Health Secretary with us. Thank you very much for speaking with us. Considering the situation in Kerala, especially about Nipah, what kind of special orders have been provided in the state of Tamil Nadu?
See, in Tamil Nadu, though it's a bordering state, at present our focus is on creating awareness. All the deputy directors and the collectors have been informed about the symptoms of Nipah and how it is spread, all the basic details. Because earlier also in 2018, when Kerala had this challenge, and 2019 one case, similar systems have been in place in Tamil Nadu. We have an integrated, all over India there is an integrated disease surveillance program which takes into account all kinds of diseases, especially the communicable diseases. So under this, since Nipah is already known about what are the causes, like fruit bats issue, then spoiled fruit issue, which is spoiled by, based on the bats biting it, plus pigs, those kind of awareness things about what are the causes, transmission, symptoms, everything has been told to all the collectors and deputy director health. Parallelly, on the borders, even though the borders are quite far away, but still all the 9 bordering districts, especially the districts like Nilgiris, Coimbatore, which are very close to these places, 2 to 3 hours away from the place where one case has been found, they have also been alerted to include checking up as part of fever concern. Keep in mind these symptoms also. So that also is parallelly going on. And in addition to COVID and ZIKA and other causes of fever being monitored, any other fever causes which cannot be placed is also being monitored in the border.
Also, Kerala is reporting one of the highest number of cases when it comes to COVID-19. Is there any plans about restricting passengers' movement between the states?
See, at present there is no such plan because some of the borders we have very close contact with people with regard to people going. Some of the places the one part of the house is this side, one part of the house is that side. But as far as our main focus is on ensuring that just like Kerala, even some of the districts in Coimbatore, Erode, Tirupur and all, the sero surveillance has revealed that the sero surveillance is fairly low. Similarly, vaccination also we are given exclusive focus into all the border districts, and even in our recent meeting with the Union Health Minister, he highlighted the need to focus on the 9 border districts for ensuring 100% vaccination in those areas. So our Honorable Chief Minister also asking us to focus, and our Health Minister, who also was part of our visit to Delhi, has been emphasizing that we are planning. We are intensively doing, and we are also planning to have a mega camp focusing on these 9 border districts to improve the vaccinations. But otherwise, for routine travelers, not the day-to-day travelers, we have also checking up the RT-PCR negative thing is being insisted upon. But the fact is there are number of smaller routes where people can come by walk and all. There awareness is being created that they need to self-monitor. Any remote symptoms of this fever also they should do. 100% contact tracing of cases in case of any reports of COVID or fever reports through fever surveillance also being done.
For now, any samples when it comes to Nipah has to go to Pune all the way to NIV. Any plans of creating any labs in the state of Tamil Nadu to reduce this time?
See, for certain things, biosecurity levels are important. You cannot randomly keep doing. Of course, I also read in paper that there is a transient kind of lab even in Kerala. But in Tamil Nadu, at present, 30 different kinds of viruses can be detected in the King Institute and all. Then we have extensive lab for COVID. But with regard to higher biosecurity level viruses, we have a system of transporting it to Pune. So at present that facility is there, even though we have capacity to do an RT-PCR, but the biosecurity levels are important. For certain diseases, you have to send the samples. So we have, earlier also the Pune lab has been very responsive in case we send a sample of not only this disease, all other diseases which are not covered in our present lab diagnostic schedule.
And also with the reopening of schools, we are hearing about students turning positive, and a minimum of 25 students have turned positive from 1st of September. So is there any change of modus operandi when it comes to schools currently?
See, at present we have opened only 9 to 12th class students, and that too after the medical committee also, the state's levels expert committee also was telling about the stress which the students are going through, mental stress for not having been able to come for a offline study, online facilities are there. This is also not compulsory, online courses are also been offered. So based on willingness they are coming. What has happened in the first 2-3 days we need to understand is that 1% of the population even now turns positive, and we have inter and intra-district variations. So these were expected because this is a result of surveillance. However, we will keep the fingers crossed, and in our bi-weekly meetings on the issue, this will be discussed with stakeholders including school education, and also finally it goes up to Honorable Chief Minister on the way forward. So as on date, these are all sporadic cases, in isolated and sporadic cases which are being handled as part of SOP, and of course standard practices are being followed. However, we'll keep a close watch. In health we cannot give decisions across the board. These are all developing situations. We are keeping our eyes crossed. On a day, 3 to 4 students or 1 or 2 teachers reports are being collected. We are collecting them and keeping a close watch on the situation.
Thank you so much. So on a day, a minimum of 2 to 3 students are being being tested positive for the case of COVID-19. However, the State Health Department is keeping a very close watch in the situation. With Divyan from Odmada, for India Today.